will join us here for the next topic, that is the right supplements for anti-aging. And this session will be taken by Miss Annie, ladies and gentlemen. She is here with us. We all are actually really looking forward to know the real secrets of anti-aging, because we all ladies really want to never age.
So you all have had a long day. Thank you for waiting for my turn. It's been a long day, so I thought that I'll say one thing, that everyone has spoken about wonderful things in the past year, and most topics have been covered. So I had to shift my slides last minute and make them relevant so that you don't have repeat messaging coming to you. How many in this room are doctors? Wonderful. This is exciting. Okay, so I'm talking mostly to a educated community, and that's really nice. Welcome. So let's start here, because I am a functional medicine practitioner. To start again, my name is Annie Kanwar. I practice in New Delhi, but I also meet people online. And I have a practice of functional medicine and nutrition. So I actually look after people without medicines. I actually only use vitamins, minerals, supplements, diet, lifestyle, advice on food as medicine. And I try and make sure the diet is corrected. Sometimes it's not always understood by people that you don't have to have vegetables. Maybe it's not good for you at a certain point because you've got an overgrowth, you're having bloating, you're having indigestion, but they think that non-veg chhod dete hain, vegetables khane lag jayenge, so maybe it'll become better because maybe I'm eating too much of the wrong thing. That's not true. It's a really big issue with a lot of people with too much messaging and a lot of... so my job is to correct people's diets. First, educate them for what their needs are. I practice personalized medicine. So let's start here with what is functional medicine. And I'll let the famous doctor do this for us. He comes online. It was quite nice. It was a concise video from our very famous Dr. Mark Hyman, which a lot of you know him already. And I wanted to tell you that these are the functional medicine diseases that people come to me for, and chronic conditions can really benefit from functional medicine. Functional medicine is root cause medicine. It is the medicine of why. Why is this happening to me? And we try to tease out root causes, and we try to look at addressing root causes by understanding them with sophisticated testing when it is available to the clients. Those people who don't wish to test, then I try to use my clinical judgment or try to use testing in India, whatever is available, and try to tease out root causes as best as I can with just simple blood tests that are available to me. But I do offer all the best sophisticated testing, so I'll be looking at that now. So these are the disorders that we have actually seen success in with functional medicine. The doctors of the future will give no medicine, but will interest his patient in the care of the human frame, in diet, and in the cause and prevention of disease. Can you believe this was said by Mr. Edison in 1903, and we are sitting here today with all the most incredible doctors in the room itself. So I'm so proud of all of you to have come ahead and joined us in this journey, because it's a very difficult journey for us without you guys. So I wish for all of your support to look at functional medicine as a thing that stands with you, besides you, to help your clients with you. All diseases begin in the gut, for me particularly, because I am trying to be a functional medicine practitioner who looks at the gut first. And the role of gut permeability in the pathogenesis of some of these chronic inflammatory conditions has been proven in research by Mr. Alessio Fasano, and we read a lot about his research in our functional medicine studies. So this on the left would be what is a healthy gut wall, and you can see the stacking of the cells with finger-like projection, which are villi, where all the micronutrient absorption happens. Along the stages of life, where maybe you've had bacterial exposures, maybe you've had a lot of infections, or you've had a couple of rounds of antibiotics or stress, and maybe traumatic brain injury, which will give you a leaky gut within hours, and many other causes that can cause this kind of a picture inside the gut, where the villi, even gluten, exposure to food intolerances can do that. So when you look at the gut which has malabsorption, it is only because there is not enough surface area on the villi to absorb, and then the pathogens or food particles can leak through these walls in the middle and go underneath. 80% of our immune system resides in the gut. So when the immune system is exposed to something like a piece of wheat, then it will recognize the gluten part of that wheat and maybe mistake it for a bacteria or a virus. This concept in functional medicine is called molecular mimicry. And in molecular mimicry is where then the immune system starts targeting your own body organs. So perhaps it's still looking for that piece of wheat that it found leaking through here, and then it has repeat exposure of that, because in India we end up eating a lot of roti every day and so on. And eventually it gets into an autoimmune mode and starts recognizing it inside your thyroid. Or it could be that it had a bacteria that came through and then it starts recognizing it inside your joints, and then that could be considered rheumatoid arthritis. So there is a lot of causation linked to leaky gut with chronic autoimmunity, and one of the preconditions of autoimmunity now is considered that you must have exposure to a trigger, you must have genetic predisposition, and you must have a leaky gut. So that's where I come in first. With autoimmune patients, I will always try to address their leaky gut. And when I do that, I see a lot of improvement in their conditions. This is an example of a person who came to me, and his leaky gut, he didn't have any symptoms. He didn't have any autoimmunity. He was just a person like us. He's 60 years old then, 59 years old then, and he just had a curiosity about functional medicine, and he said to me that I'd like to know all my tests. Why don't you just do some leaky gut tests for me? The very first column you can see, it's talking about absorption capacity. And it's in the red because that's showing you how badly damaged his gut is from the past so many years of living on this earth and so on. We are no longer what we eat, we are what we absorb. That's what it said. And you can see the intestinal permeability on row number 2, gastric permeability and intestinal damage all happening. Now, obviously, you would turn around and say, hey, you know, not everybody can afford these tests, so what do you do? And agreed, this person was lucky, he came to me, he had a test done, and we were able to identify his leaky gut and then reverse it. Because things like this can be sent abroad, okay, it costs like $100, and some people are able to afford it and some patient population doesn't afford it. But imagine if a practitioner had seen this, and this is a vegetarian man, and not done the test, and assumed that, you know, the foods that you probably eat are gluten and dairy. Dahi khate ho, roti khate ho. So why not remove these two foods? हम अपना clinical judgment लगा के दही और रोटी आपकी हटाते हैं, सबसे पहले dairy हटाते हैं और gluten हटाते हैं और फिर आप ठीक हो जाएंगे. This test is in fact quite a nice test. It's not so expensive, should be considered, because look at the next slide. He is not lactose intolerant at all. In fact, he may not be casein intolerant at all. And then I would have had to remove his dahi, his paneer. How does he get his proteins then? You know, he's practically living on just vegetables and I remove his gluten as well. So in this case, I was very lucky. I was able to remove just his gluten. Now, this man's worked with me for some time. Since this is a longevity conference, we did a biological age test on him. His chronological age is marked below at 59. And when we did it after he worked with me for about 4 months, this was his biological age at 37. Because we fixed absorption, we fixed heavy metals, we fixed gut dysbiosis, we reduced fatty liver, we fixed the metabolic picture, the whole story, okay? And that's how functional medicine supports longevity, because you end up fixing it right from the gut. And this is another client of mine who came to me age 22. I have been suffering from ulcerative colitis and no doctor has helped me. He has a lot of money. He's living in Pune. He's the child, but his parents are very wealthy. So he said, you know, I don't know what to do. All the gastroenterologists have given me steroids. Rovasa is the medicine of choice. And, you know, I've been on it for 2 years and nothing has stopped. My bleeding is just not going away. And I said, okay, let's start with a gut health analysis to see what is your microbiome picture like. And we started here. So we looked at his microbiome picture. You can see this is called a dysbiosis, when there is commensal bacteria inside your stomach and it's off because it's overgrown due to some exposure. And then he has an H. pylori content, and some good bacteria is low and the rest of it is high. And we carry on looking at this. This test also showed me that his intestinal markers, what they were looking like. But if he had gone to a conventional doctor and done an endoscopy, it would have shown an H. pylori positive person. And then it would have been put on the triple therapy, which is what we use as a choice in conventional medicine. But here you can see that those medicines he is absolutely resistant to. So none of his H. pylori would have corrected because of this reason. And they would have not known that, and they would have just carried on giving him repeat antibiotics, which would have perpetuated the dysbiosis in the stomach, because you can end up killing the good bacteria as well. and this child would have never felt better. His parents felt very distressed because he was very depressed. And after we corrected his thing, this is the message I got from him. I just thought I'll show you. Hi there, good morning. An update for you. 0 blood in the last 2 months consecutively. Reduced symptoms in terms of pain and stool frequency. Reduced to a point where it doesn't even cross my mind on most days. I had an issue, which is fantastic. And this is fantastic for me to show because I did not use any medicines. I only worked with vitamins and minerals and changed his diet. And that's a child who had suffered for 2 years with bleeding in his rectum, right? And now we have put ulcerative colitis into remission because this message is from September and now we are in March and it remains the same. He's only improved. He's even gone off his Rovasa now. He doesn't need to take it. So this is another kind of test that I offer, which is done to look at a very comprehensive understanding of human health, and is talking about methylation, talking about toxin exposure, your omega balance, mitochondrial function, and oxidative stress in the body. Oxidative stress is behind a lot of cancers, and it's a root cause because it's causing inflammation. So these are very extensive tests. This test was again of a very healthy man who works out, looks after his health, and said to me, everything is fine. I don't really need to test, but since you're talking about it, let me just test it with you. And look at his micronutrient picture. It's all falling in the reds and the yellows. Everything is down and everything is low. So there is a need for micronutrient replenishment here. There's a need for nutrient balancing. And when I showed this to him, he was quite surprised. He said, oh, but I work out so much and I eat well. But this is what happens because you're no longer what you eat, you're what you absorb. Every cell goes through millions of these cycles in every second. And the reds are where the heavy metals are interrupting that cycle. And all these others are very dependent on cofactors. I don't have a laser pen, sorry to show you, but they're dependent cofactors on iron, magnesium, zinc, all the micronutrients and vitamins and minerals are needed for these processes in the body. And of course, the test continues. It's a very extensive test. It gives you the picture of your organic acids. It gives you a picture of essential metabolic fatty acids. I do find that in India, most patients come to me, they have a very skewed omega-6 to omega-3 ratio, and probably because of eating a lot of food in the restaurants outside, which are all using omega-6s, and they don't have such a high omega-3 because we are not fish-eating community, probably. Many reasons it could be. And this is how many enzyme and cofactors are needed to process your omega-3s and omega-6s. So again, it shows you the need for cofactors like B2, B3, B6, vitamins, zinc, magnesium. In every stage, you need these vitamins and minerals to make sure that we are. Switching to another topic about what kind of patient population one sees in functional medicine. How toxic are we? Was spoken about that lovely doctor from South Africa. She was sharing the same slide. In fact, I was laughing with her and saying, I had to change my whole slide deck because of you. It had a lot of similar talking points about chemical, and I only kept the one. This is a study done on Canadian newborns, and actually we all sit here and think Canada is so clean, right? So if Canada is showing this kind of number, you can imagine what India is showing if we actually do these kind of tests here, which we haven't. And they found 137 chemicals inside the fetal cord blood. Of course, the list is endless, and that is how our next generation is being exposed to so much toxin chemical. I have Barun here, who helps my home with cleaning up the toxic air. He's put these special filters which take care of NO2, SO2. He's monitoring them. He's looking after all the air filtration all over the house. And I know that Arjun uses him as well. For Selexity Mall is one fabulous place. I love to go there because I feel like my lungs are not exposed to SPM. And that's a really good thing you've done, Arjun, apart from having this wonderful conference. Thank you. So this is a report, one of those sad reports of an autistic child. He's only 3 years old. And you have never seen a report on a 3-year-old with this much toxicity from mold exposure. So this is all mycotoxins that are coming out of mold. And you can see that he has multiple species, and they are very, very toxic to the brain. Mycotoxins are produced as toxins from mold exposure. Now, he could be having mold in his house somewhere. So that's why I mentioned Barun here, because he does have filters that take care of mold spores. And I did do a test with him about all my air vents, because they're all like this, these kind of air filters, HVAC systems, and he put like this little system inside and checked all the for mold overgrowth. And I'd like to do that again, just to make sure it's still the same, because we should do it yearly. Multiple mold species, autistic child. So, the thing is that when he came to me, the parents are like, this has suddenly happened, I know it's got a genetic component, but there must be something we can do. And we said, okay, let's look at root causes. And then we started here. I obviously did his routine blood test, and I looked at the gut dysbiosis. We have corrected the gut dysbiosis. Now I'm removing the mold. But the sweetest thing is this. So the school sent the message to the mother. I want to inform you today, the baby is doing the great task, all his sessions doing nicely without any refuses. So I have given him 1 star for his token economy. What I'm trying to say is functional medicine is helping remove toxins from babies. We are trying to do good in this world, and that star actually belongs to functional medicine. It's done wonders to this child. I have millions of such messages from this lady because she is feeling so happy. Her child used to hit and bang his head and hurt himself. All that has stopped. He's sleeping through the night. He's completely comfortable. Everything is okay. So I just thought this is a little moment of joy for me because, again, I did not use medicines. I only used vitamins and minerals. And I only use diet. I don't use medicines. I cannot prescribe medicines. I am a nutritionist. I rely on my doctor colleagues, my lovely doctor colleagues, to help me when that is needed. It's not like I don't approve of it. I love it. When it's needed, it must be done. But when I can help people without it, then this is the way to go. Okay? We've spoken a lot about this for the last 4 days, about what happens when regular persons come to me and say, we're not really sick, but we want to look at longevity. What would be my advice to such persons? Then I say that, we have to guard against cardiovascular risk, cerebrovascular risk, cancers, neurodegeneration as we age, and metabolic diseases. We were looking at diabetes, fatty liver, insulin resistance, etc. And they're all falling. They get higher and higher as a risk if we are not mindful of our lifestyle as we get older. And everybody has spoken about this already, so I don't want to dwell into this. Components of lifespan as well as health span are to prevent cardiovascular disease, control the inflammation in your body. So that's what we do. I look at inflammation and I don't prescribe NSAIDs, which are non-steroidal anti-inflammatory drugs. I actually prescribe herbal NSAIDs, which do not have any NSAID component because NSAIDs are very toxic for your gut lining. They do give you, intestinal permeability in long-term use or just using them ad hoc without realizing. So it's better to try and find other measures of controlling inflammation with things like, we have a lot of good stuff, like there's a brand I use called Biotics Research, and they've got a product called Caparest. It is research-based, it's all evidence-based products, and they will show it on research how much inflammation comes down from using those in long term. Optimize the blood sugar and insulin. Optimize your weight, and make sure that you keep on developing muscles and look after your bone health. To read just a few, I do have a limit on time. Foundation pillars include exercise, diet, sleep, controlling inflammation and blood sugar, which I don't want to elaborate further because you've already been through this and there are a lot of doctors here. So it's not something that I need to elaborate on. Management of lipids, how do I do it versus doctors, is that I do have therapies to lower ApoB, LDL, VLDL, triglycerides. I use red yeast rice. The one that I use is checked for citrulline, which is a toxin found inside red yeast rice. Please be careful when you buy red yeast rice from the market if it is not loudly proclaimed by the company, because those ones that test for citrulline will be shouting it from the rooftops that we test for citrulline. And this brand tests for citrulline, so I like it that it's no citrulline in the red yeast rice. It's a toxin for the human body. So this one, and then I sometimes will use niacin, and sometimes, omega-3s are used to improve HDL function, high extra virgin olive oil and nuts, omega-3s, vigorous exercise, weight loss. Inflammation, again, I think we've already spoken about what we need to do here. I've given you an example of Caparest, which is the product I use for inflammation. And of course, inflammation has to be quelled with free radical and oxidative stress management, for which we have excellent antioxidants, which I'm looking for in the world, and then I find good companies, and then I'm now providing them on a site for myself primarily, and for all the other practitioners who are happy to work with me. That'll be just lovely. So the cycle of inflammation that feeds chronic disease is that, you get an inflammatory trigger probably from one of these issues here. It could be that you have smoking habits, environmental toxins, chronic infections, gut dysbiosis. And then if it's poorly resolved and it carries on into your body, it can cause persistent cellular injury, which gives these kind of danger-associated molecular patterns, which again sends off an inflammatory trigger. So this is a vicious cycle established, where you can eventually see tissue breakdown, and that will start disease manifestation. So you can start looking at those disease cycles, the diseases mentioned there, and link them as a root cause inflammation. So this is why this slide is important to understand that cancer, diabetes, chronic kidney disease, osteoporosis, autoimmunity, where did they begin? So that's the point where we need to capture our clients, at the point where, at least I do, I try to, in my functional medicine, capture them at the point of inflammation so that I don't go down this pathway. Supplements that I use for inflammation are mentioned here: kappa rest, CoQ enzyme is very good. Vitamin D has to always remain in range. Biotics research is this brand, but I also have allergy research, and I have a couple of other brands that I'm talking to right now that I plan to bring, who I like. This supplementation, it's not an exhaustive list. We do have a lot of stuff for quelling inflammation, free radicals in this range. Preventing metabolic disease. What I do for prevention is that I use this, for people who are pre-diabetic and who are not careful with their diet, but they do exercise a little, but they end up eating on weekends and so on. This is a very good product. It's a balancing of your glucose because it's got magnesium, it's got chromium, and they are not interested to have too many vitamins and separate doses of different vitamins and chromium and all that. So it's all in one capsule, and it makes a lot of sense. Then I give them this 3 tablets twice a day. Berberine is an outstanding choice for improving blood sugar control. It is comparable in effect to oral hypoglycemic drug metformin. The doses are between 0.5 grams to 1.5 gram daily. I've used it very successfully, even on myself. In fact, there was one lying outside and I said, you know what, it's going to expire in 1 month. I'd rather not sell it to somebody, I'll just use it for myself. So falls are the #1 cause of accidental deaths in those over 65. Studies have found that if you're over 65 and you fall and you break a hip, there is a 25 to 30% chance you will be dead in 1 year. For men over 85 plus, the number may be as high as 43%. When we see it like this, it sounds quite scary. Even I didn't know this till I found this slide, that it was this high a number. Well, we can see that they are marked on the skeleton, that where the actual fractures actually happen as we get older. Up to 92% are happening in over 65-year-olds are proximal femurs, 70% are femoral fractures over 65, 55% have humeral fractures in over 65, 44% distal over 65. These are the common sites when somebody falls. It's very clearly illustrating here why muscle strength and balance particularly are very important as we get older. So, yoga, by the way, it makes a lot of sense because it provides a lot of this. It takes care of muscle strength and balance really well. Bone health, we've discussed the staggering risk of dying from a hip fracture. So having healthy, strong bones is really important. Building and maintaining strong muscle is also the key to supporting your skeletal structure. Ensuring physical health requires muscle development, cardiorespiratory fitness, bone health, and weight management. These are the 4 pillars. One of the things I use for bone health is this potassium because it reduces resorption and improves bone mineral density. There's a formula in bone, just for the layman here, that the bones they get reabsorbed and they get made again, and that's a cycle that continues. And this one has an action on the reabsorption side. So good amount of potassium also comes from green leafy vegetables. So people are not eating that much of that today because they're keto dieting. So sometimes I have to supplement it for those people who are especially trying to be paleo and keto, and they want to remove not too much vegetables in their life and so on. And then I try to introduce this so that we can support bone mineral density. Vitamin D, we have spoken about. This one is really special because vitamin D is a fat-soluble vitamin. And this one is emulsified in oil. So when you take this, it's highly bioavailable because it's already going in with oil, unlike all the other vitamins that you will see in the market. And of course, it's all high-end with no pesticides and fillers and all the other stuff that you should take for granted when you talk to a functional medicine practitioner, that we do tend to use the best-in-class products, or at least I think so. any exercise is better than no exercise. What is the most optimal exercise to undertake? It appears that resistance training is very beneficial as we get older. And can you build muscle later in age? This was a study that was very interesting. It showed you, right on top is, on the top right, is 40-year-old triathletes' muscle. Along that on the right is his little bit of fat, but that principally is muscle, the black square inside, the black circle. And then you see a 75-year-old sedentary man. You know, the kind of person who sits in office, he has to go for meetings and keep on sitting all day and so on and not really working out. Look at the adipose tissue, how much it has taken over, and look at what has happened to the muscle. It's so much more adipose tissue than it is muscle. And these are pictures of the quadriceps, the legs. And then you have a 70-year-old triathlete. Look at the comparative thing between a 70-year-old and a 40-year-old. This is very promising for us to see. And the current recommendations for adults, weight training at least 2 times per week, and 150 minutes of moderate aerobic activity, or 75 minutes of vigorous physical activity. I say even if we do yoga, there is a lot of resistance training in that. You use your own body weight. And then, you know, you're getting a lot of cardiovascular rhythm, but you're also reducing cortisol, because that's what yoga has shown in studies to do. Research has shown that it reduces cortisol. So that can be very beneficial for people who don't want to do something vigorous for 75 minutes. And it's very good practice to inculcate. In preventing sarcopenia as we get older, because we may not be able to build muscle, but at least we should try to strengthen the muscle we have. As we get older, that's an option. Okay, we can't maybe build muscle anymore that strongly as we could when we were younger. So some of the supplements that we recommend, I actually like this whey protein only because it is casein free. And I don't like to use casein and gluten in my patient population because mostly they have a leaky gut. And casein is a milk protein that does not transform even if you heat it or you try to change it in any form, and it'll always keep showing up. So this is the reason why I like this whey protein. And whey protein is quite beneficial for muscle building. And pea protein is hypoallergenic, so it's really nice for people who have digestive issues. They are able to digest the pea protein much better all across the gut health spectrum. So these brands are there. There are about 2 others that I've used and I like, which I will put on my bestnutrients.com site, and you can find them there, probably. But I'm still talking to them, so I don't want to show their photographs. This brand I've already spoken to. Summary, we must begin to treat patients before obvious symptoms occur. Preventing and significantly delaying the onset of chronic disease results in longer lifespan and health span. Through diet and exercise, sleep and supplementation, we have the ability to prevent almost all chronic disease. So it's a nice positive message. And what are the manufacturing standards that I look for when I'm looking at companies that give supplements so that I can use the best products in my clinic? I don't go for the 0, 1, 2, and 3 or 4. I try to stay with the 5 and the 6. And the 5 and the 6 are saying the companies that produce their raw materials have an ISO certified lab, are FDA inspected, because in USA they don't have FDA approval on supplements, but at least they're FDA inspected, and maintain GMP certified manufacturing. And the second lot is companies that have GMP certification or certified manufacturing and have an ISO certified lab. So this is where I'm putting my benchmark as a target benchmark for products. And the therapeutic dose products that I use for practitioners are different from what is available in the market, because those are RDA. That is limited in India, and it's, well, appallingly low for all of us practitioners. Please don't put that on a YouTube video. but we have to use stuff that is therapeutic dosage. So as practitioners, I'm sure you will all appreciate that, you know, we should try and get quality products into our clients who are very sick. At least the people who come to me are very sick. I try my best to make sure I maintain all standards from everywhere. Best-in-class testing, best-in-class products, and that's how I have managed. This is the upcoming website. We were invited here sooner than we have begun. It'll be up in 1 month, maybe 2 weeks, if I push my staff. They're outside lolling about for the last 2 days. And you can contact us or contact me. My cards are here. Please take a card, and it'll be a pleasure to work with all of you practitioners here. And for the clients, you're welcome to talk to us, and we are able to guide you on all the things that you need from this site.